So is semaglutide a miracle drug?
I'm not sure it is. I wouldn't necessarily call it a miracle drug, but it is a very, very good drug and a really major addition to what we've had over the years. You need to remember that since the 60s or so, we've had some successes and many failures in the field of obesity pharmacotherapy. And you'll also need to remember that in the UK, at least, for approximately 10 years, the only medication we could use for obesity was orlistat, which was not the easiest medication for people to take. So since the introduction of Saxenda, and now with the introduction of Wegovy, we're seeing a major revolution in the treatment of obesity taking place as we speak. There is a lot more to do, but the semaglutide addition is a really good step in the right direction.
There's been a NICE technology assessment on semaglutide for obesity management that was published in March 2023. What did this say, basically?
So NICE, the National Institute for Clinical Care Excellence in the UK, is an organization that assesses not only the efficacy, but also the cost effectiveness of new therapies for any kind of disease. And what they did in this single technology appraisal is that they assessed the efficacy and cost effectiveness of Wegovy semaglutide 2.4 milligrams for the treatment of obesity. Now, you are right to say that most of the NICE guidance applies in England, but there is a lot of interest in the NICE appraisal process because it is also used very widely in Wales. It is used in Northern Ireland as well, but also because of the robustness of the process, it serves as a guide to many other countries that follow eventually the same pattern or approach to NICE. So it is therefore important not only for the UK, it's important for many more countries. So what happened in this appraisal, the committee assessed all of the clinical trial data and at the same time assess the cost effectiveness of the medication. And by doing these complex health economics, the decision that was made is that the medication should be available to people that have got a body mass index of predominantly over 35, even though there is some allowance for people within the body mass indices of 30 to 35. This needs to be adjusted depending on someone's ethnicity as well, and people who have got at least one obesity complication. It will be available through what is called specialist weight management centers. That is therefore a group of clinicians that are trained in the treatment of obesity. And what is important to understand is that this group of clinicians that does not necessarily have to live in a hospital setting. They can be anywhere, including primary care, the community, etc. This is in contrast to the guidance, the single technology assessment and guidance on Saxenda, which very specifically said that it should be available from what is called Tier 3 services in the UK, which are predominantly in secondary care. So this is a major change, and it means that the access to the medication will hopefully increase because of that change. It's important also to understand that a number of other things, that the eligibility for the drug will not be the same as the summary of product characteristics. Because according to the summary of product characteristics, this should be available to people with a BMI over 27 with a comorbidity or people with a BMI over 30. So it's important that people do not confuse the two. And the second and important thing to say is that the medication will be available for 2 years. And based on the cost effectiveness of the drug, beyond that, it is not cost effective and it should be discontinued. That will create some more questions, and some difficulties and challenges, because we do not stop any treatment for any other chronic disease. Therefore, there is no reason why we should do that for obesity. But overall, even though this is not a perfect guidance, it is a good guidance, and we'll just need to work around the challenges that it creates.